Namaste. Welcome all. Happy evening. I'm Dr. Swati, counselor. He is my colleague, Mr. Manikishore, counselor, team Manojagrithi. As we all know, yesterday we grandly inaugurated free webinar series on psychological disorders. Today we are discussing about generalized anxiety disorder. Before going through today's topic, let me brief about Manojagrithi. Manojagrithi is a non-profit organization established with a vision to spread mental health awareness and prevention of mental health issues. Since 2 decades, Manojagrithi conducting several programs in various wings of it. Under the guidance of Dr. Geetha Challa, the founder of Manojagrithi, we pursued Diploma in Basic Counseling Skills, which is called Sahaya, under Geetha ma'am, and our coordinator, mentor, Vijayalakshmi ma'am. Let me welcome Dr. Geetha ma'am to spread few words on this webinar series.
Good evening, all of you, and welcome to this webinar, Generalized Anxiety Disorder. Actually, we started this series of webinars with this GAD, as we thought this is very common and overlooked by many of us. Generally, we think that this person is like this from the childhood, and we have been, watching people being into anxiety. And there is a term when, recently I was discussing with one of my client, habituated anxiety. Habituated anxiety is like they get used to that worry all the time. So today, let us scientifically understand what is GAD from my beloved students, Mani and Swati. All the best, Mani and Swati.
Thank you,
and
ma'am.
Looking forward to listen from you people as a participant again. I'll be sitting with you people, and I'll be there for Q&A at the end of the session, and wish you all the best.
Thank you, ma'am. Thank you, ma'am. Before jumping into the topic, I would like to settle down all our senses and relax through mindful breathing and grounding technique. Breathing, it is a gateway to our autonomous nervous system. Breathing is a natural rhythm of inhale and exhale. Let's sit comfortably. Remove all your tight accessories. Sit erect. Keep your backbone straight. Place your both hands on your knees. Close your eyes gently. Make sure your feet should touch to the ground. Relax your facial muscles. Relax your jaw. Drop your shoulders. Relax all your body muscles. Relax. 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 Now, bring your awareness to your breath. Inhale. Exhale. Inhale. Exhale. Notice the sensation of air entering your nostrils, filling your lungs, and then gently leaving your body. Don't try to change your breath in any way. Just observe it as it is. Gently notice the rise and fall of your chest, belly, as you breathe in and breathe out. Thoughts may come and go like a passing clouds. Don't run behind the thoughts. Gently guide your attention back to your breath. Inhale, exhale, inhale, exhale, inhale, exhale. Just observe the breathing. Relax, relax, relax. Now slowly inhale through your nose, deeply feeling your belly expanding with air. Hold for a moment. Slowly exhale through your mouth, feeling your belly compact. We will repeat this 2 more times. Slowly inhale deeply, feeling your belly expand with air. Hold for a while. Exhale slowly through your mouth. Inhale. Deeply into your lungs and belly should fill with the air. Feel the fresh air. Exhale slowly through your mouth. Now, slowly breathe in and breathe out. Just observe the breathing pattern. Relax. 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 Gently keep your eyes closed. As we know, we are connected with our body through 5 senses because of our lifestyle. There is our overconsumption of our senses. So we need to get them to be grounded. Now, let us to tap into our 5 senses. We will go each one at a time. You can close your eyes and do this mindful activity. We will begin with the sense of hearing. Now, listen 5 different sounds around you. Non-judgmentally, just observe them. It might be the fan sound. It might be a horn from outside. It might be a knock on the door. Just observe the sound. Don't judge them. Now, let's move to the sense of touch, that is, with the feel of skin. Now, touch 4 different surfaces with your dominant hand and feel 4 different textures. It might be the arm of your chair, palm of your other hand, texture of your hair, surface of your table. Observe them non-judgmentally. Continue to keep your eyes closed. Now, gently tap into the sense of smell. Observe 3 different smells around you. The smell of your sleeves, the natural fragrance of your room, the fragrance of your hair, or the fragrance of your clothes. Be non-judgmental, just observe them. Gently tap into the sense of vision. Rub your both hands. Gently rub your both hands. Place them on your eyes. Feel the warmth and feel the freshness. Open gently your eyes. See any 2 things around you. Any 2 things around you. Just observe the texture, color, size, and shape of the things. Be non-judgmental. Just observe them. Now, let us to tap into our sense of taste. Take the cookie into your palm. Observe the texture, shape, color, and size without judging it. Now, put the cookie into your mouth. Bite it slowly. Feel the taste. Feel the saliva comes from the taste of the cookie. Turn it all your mouth with the help of the tongue. Feel the texture, the toppings of the cookie. Feel the each ingredient taste completely. Now swallow it completely. Let's feel the journey of the cookie from your mouth to the gut. Without judging the cookie, just enjoy the cookie. Welcome you all once again. Hope you all refreshed. Let us to go through the today's topic, generalized anxiety disorder.
Hello all, good evening. So as a part of webinar series, today is day 2 and we are going to discuss generalized anxiety disorder today in this session. So this is the agenda for today's session where we are going to discuss the criteria, causes, impact, treatment, myths and facts, and a short role play and tips and takeaways for the generalized anxiety disorder. Before we start what generalized anxiety disorder is, I want to explain and discuss about what fear, anxiety, and stress actually is. So, in our day-to-day life, we generally come across these terms fear, anxiety, stress, and in this current era, using these words has increased a lot comparatively. So, what fear exactly is? Fear is defined as a basic intense emotion triggered and perceived threat or danger, whether real or imagined. It is kind of a survival mechanism that prepares the body for action through psychological and physiological changes, commonly known as flight or fight response. Symptoms for the fear are we get racing heart, sweat, shortness of breath when we suddenly experience something. So flight and fight response. So fear activates the body's defense mechanism, either preparing us to confront the threat or escape from it. So confronting the threat is fighting mode and escaping from the threat is flight mode, where we run away from that situation. And fear is a survival mechanism. Fear is essential for survival, helping us avoid risk and potential harm. I can say the example for fear is like when the car suddenly swerves towards us, then we activates the flight and fight mode. Either we run away from there or we freeze or we respond to that. And coming to the anxiety, anxiety is feeling of uneasy, worry or nervousness, often about an anticipated event or something with an uncertain outcome. It can be normal reaction to stress. Example for anxiety is like feeling anxious before interview or important presentation. We generally feel that whenever we are going to present an PPT or kind of thing, so we generally develop that anxiety. And coming to the stress can be defined as a state of worry or mental tension caused by difficult situation. Stress, like there is external factor for stress where we respond to that. Stress is a natural response that promotes us to address challenge and threats in our lives. Everyone experiences stress to some degree in their day-to-day life. The way we respond to stress, however, makes a big difference to our overall well-being. Stress can be long-term and short-term. For example, in the long-term stress, it is we unable to work or chronic illness. And in the short term, where we have deadline to complete and we develop the stress. And if we have fight with our loved one, we develop the stress. So to define fear, anxiety, and stress in simple words, fear is immediate response to actual or perceived danger. Anxiety is diffuse and general feeling of unease or apprehension. And stress is physiological and psychological response to demand or pressures. So to describe this in detail with an example, I'll tell a situation to differentiate what fear, anxiety, and stress actually is. So you are hiking in a forest, enjoying the peace and quiet. Suddenly you turn a corner and come face to face with a large growling bear, just 20 feet away. In that exact moment, you would experience intense fear. Your heart would pound, adrenaline would surge through your body, your breath would become shallow, and you would feel an overwhelming urge to either run as fast as you can, which is flight mode, or freeze completely. It is part of a flight and fight response, hoping not to be noticed. The threat is the growling bear, is immediate, present, and undeniable. And when it comes to anxiety, in the same situation, we are planning a multi-day backpack trip into a remote wilderness. For its wildful, including bears and mountain lions, for weeks before your trip, you might experience anxiety. You constantly worry about what if I encounter bear? What if I get lost? What if I get hurt and can't get help? What if the weather turns bad? These worries are persistent, not tied to an immediate danger, and can lead to restlessness sleep. Obvious research about bear. We sometimes do research about bear, whether we are going to be safe or else how to encounter the bear if the bear comes. So even when you are safely at home, we know that we are safe at home, but we do all this. The threat in the future feels uncertain. And when it comes to stress, the entire process of preparing and undertaking the long, challenging hike in wilderness is stressful situation. This includes like planning, carrying heavy backpack, dealing with changing weather conditions, and potential animal encounters. So these all create a stress. So once the event is completed, the stress may go automatically. To summarize this natural example, like fear is the intense immediate reaction when a bear appears suddenly and growls. The ongoing worry and potential encountering dangerous animals or other dangers before a wilderness trip is anxiety. The physical and mental demands of planning and executing a challenging wilderness hike itself, including vigilance and physical exertion, is stress. So, this is about fear, anxiety, and stress. Before jumping into the actual presentation, I would like to open the chart box and I'll give some few examples about what fears, anxiety, and stress is. Kindly respond to the examples whether it is fear or anxiety or stress. So here the example is seeing a snake on a hiking trail. Is it fear, anxiety, or stress? Yes, I see a lot of fears. Yes, it is fear. And different example. Feeling a persistent sense of dread about global events or the economy. Yes, anxiety it is. And trying to finish 5 major assignments due on the same day. Yes, I can see a lot of stress. Yes, it is. And the another example is always imagining worst case scenarios when loved one is late coming home. Yes, it is anxiety. And a child seeing a large unfamiliar dog barking aggressively. Fear. Yes, fear it is. And the last example, constantly worrying about an upcoming job interview weeks in advance. Yes, anxiety it is. Thank you for your responses. So now moving into the topic, anxiety. So as discussed, anxiety is an emotion characterized by apprehension and tension in anticipating future threat or misfortune. It involves feelings of worry, nervousness, and unease, often accompanied by physical symptoms like increased heart rate and mental tension. So here we need to differentiate what anxiety is, what anxiety disorder is. So what anxiety disorder actually is? While anxiety can be normal and even helpful in some responses, anxiety and stress at some time motivates us to complete the task. But where it comes to anxiety disorder, it becomes a problem when it's excessive persistence and interferes with daily life, day-to-day activities, potentially indicating an anxiety disorder. So as shown, just the causes for anxiety are like triggered by specific realistic problem. And when it comes to anxiety disorder, may or may not have a specific reason. And symptoms goes away when the stressor is removed. And for anxiety disorder, symptoms may remain for the long period of time. I'll give an example. A student studying in the 7th grade might be having a stress or anxiety before attending his exam. Like he will be having stress about how to attend the exam. Am I going to perform well or not? So how the question paper is going to be, and it is considered as an anxiety. What if the student is worrying about the future, how to attend 10th class examinations and how to attend the intermediate examinations and what course should be taken after intermediate examinations? So they may or may not happen. So that is a long distance one. So when the student is thinking about that, and we can say it as an anxiety disorder. So, and when he's thinking, when anxiety, it is short term, when he's thinking just about the present situation and the present exam, then it is anxiety. Usually the anxiety duration is for a short period of time. And when anxiety disorder, it lasts for months together and sometimes for years together. So example, as I said earlier, feeling nervous before big presentation. And example for anxiety disorder is constant fear of doing or saying that wrong thing. Hope you understand what fear, anxiety, stress, and anxiety disorder. Moving on, types of anxiety disorders. So in mental disorders, like there are various mental disorders. Anxiety disorders and depressive disorders are most common and major disorders. In anxiety disorders, generalized anxiety disorder is major one and most commonly seen in people. So there are several anxiety disorders as shown. One is generalized anxiety disorder, panic disorder, agoraphobia, specific phobia, social phobia, separation anxiety disorder, selective mutism. Today we are going to cover only generalized anxiety disorder. The remaining disorders are going to cover in upcoming sessions in our webinar series. So generalized anxiety disorder. So generalized anxiety disorder is mental health disorder that produces fear, worry, and constant feeling of being overwhelmed. So as we already discussed what anxiety is, what anxiety disorder is. So how anxiety disorders are different with generalized anxiety disorder. So in generalized anxiety disorder, we have persistent and unrealistic worry about everyday things. Generalized anxiety disorder disturbs us and intervenes in our day-to-day life activities. And here is the prevalence and comorbidity. Prevalence. Prevalence means how common the disorder is. So it is 3.7% of the world population experiences generalized anxiety disorder in their lifetime. In India, it is 0.57. So we may get question like why it is 0.57 in India, as India is a populous country and a lot of people are going through the stress and anxiety. Comparatively, why it is less? There are various factors why it is less in India, as our cultures and the relationship we maintain and the traditions. There are a lot of factions which are reason for the less anxiety, generalized anxiety disorder, the prevalence. And scientists also argue that there is less undiagnosed. The generalized anxiety is undiagnosed in India, and the mental awareness is very less comparatively to the other countries and developed countries. It is less in India. So that is also the reason for the less figure. And it is more in urban and metro, like married group and female. So day-to-day activities, the lifestyle of rural areas and urban areas has changed drastically. Urban people are having lot of challenges and lifestyle changes and tensions. So they have targets. So comparatively, urban people are having more generalized anxiety disorder than rural people. And when it comes to comorbidity means having the same disorder simultaneously with other disorder. For example, generalized anxiety people are diagnosed with depression about 15.8%, followed by agoraphobia, which is 9.4%. Agoraphobia is fear of open spaces. Moving on to the diagnostic criteria, Swati ma'am will explain about this. Unmute ma'am.
Thank you, Mani. DSM-5. So DSM-5, it is a diagnostic and statistical manual of mental disorder. And DSM-5 is the 5th edition. It is by the American Psychiatric Association. This outlines the specific criteria for diagnosing various mental disorders. These criteria are used by trained professionals to determine either an individual symptoms meet the criteria or not. So according for DSM-5, for the generalized anxiety disorder, the first one, excessive anxiety and worry. So which is occurring more than not at least the 6 months, but more than 6 months or 8 months period about a number of events and activities such as the daily work schedule or the school performances, daily routine challenges, and all. The individual finds it difficult to control the worry. If the worry, if it is having a certain cause, and after the cause or after the challenge, if it is the worry is vanishing, then it is not coming under to the GAD. But if it is continuing, the worry is not having a particular cause and all for every single thing. Also, if the worry is continuing, like our Mani sir discussed about it very well in the previous slides, and anxiety and worry, which are associated with 3 or more of the following 6 symptoms, with at least some symptoms have been present for more days than not for past 6 months. Only one item is when it is diagnosing for the children or the teenagers, then we can need at least 1 or 2 items has to be required to be present in them. The first one, restlessness or feeling keyed upon the edge. For any single a simple task also, if they are feeling very restless, to delete and all, if they are feeling very edge on the thing, and making themselves to be worried more than the usual, and being easily fatigued than the normal, difficulty concentrating or mind going to be blank. Generally, this can be like a concentrating on the daily challenges or the work schedule, or they are having a concentrating or the differentiating between the different works in their daily lives, or the work schedule and the daily professional life and the daily life. Or sometimes they will get the freezing of their mind and irritability on simple things. Muscle tensions means like a muscle cramps. We can see that the individual can face the back pain or severe other muscle pains and all, and sleep disturbances like difficulty falling to sleep, and restless or unsatisfying the sleep. The anxiety, worry, or the physical symptoms, they will cause the clinical significantly distress or impairment in social, the relationships or the occupational, like in the career-wise and the professional area, and other important areas of functioning. So this one, it is having the two more criteria, like if this disturbance, it is not attributable to the physiological effect of a substance, like any other drug abuse, like alcohol or some other drug abuse, or any medication, or any other medical conditions, like hypothyroidism or any another medical conditions. The disturbance is not better explained by any another mental disorders. Example, the anxiety or worry about having like a panic attacks in a panic disorders, and a negative, if it is a negative evaluation in social anxiety disorder, like social phobia and all, and OCD, like obsessive compulsive disorder, and separation anxiety disorder, and body dysmorphic disorder. As earlier, what we went through the symptoms, like a generalized anxiety disorder, here having some symptoms, we can see that restlessness in the left side, the corner picture, which is showing us very clearly the restlessness, and fatigue, and excessive anxiety and worry. So when they are worrying about very excessively and persistent, and they will be feel like a restlessness. Due to this, they can feel even the fatigue, and it may increase the muscle aches and soreness, and impede the concentration in their the daily tasks and all, and easily they can get the irritability, and which is not explained properly. So GAD, it can be having this GAD-7 screening tool. The screening, which is having a major role while making the individual to make that yes, this individual is having or going through this problem and all. So here it is the GAD-7 screening tool, and here the scale it is there. The feeling nervous and anxious, and like the 7 scale is there, and here we are having the scales like a 0 to 3. So when the cumulative of the result from this scale, if it is a 0 to 4, then it is a minimal, and the 5 to 9, then it is a mild, and 10 to 14, it is a moderate, and above 15, then we can diagnose it is a severe. So the cumulative result of from this scale and all will let us to know that the diagnosis of the individual having the disorder, with along with that the intensity of the disorder. And one more thing I want to tell, that all this diagnosing and screening should be done under the guidance of a certified professional. Mani, you can go ahead.
Yes, ma'am. Yes, very well said, man. It has to be done under the either certified psychologist or under the guidance of therapist. Yes. So before moving, like I am very uh, eager to know whether some of our participants are uh, did it earlier or they did now. If someone has did, can you mention in the chat box? Because we are all enthusiastics. Like whenever see something, we try to judge ourselves, we try to assess ourselves. So if someone has did, can someone mention in the chat box? Okay. Okay. Okay, I can see. Yes. Yeah, moving on to the next slide. I'll talk about that. So someone has mentioned 15 and someone has mentioned moderate. So it is the scale should be diagnosed, should be screened by the only certified psychologists and other certified therapists. So as we all are enthusiasts, we generally come across whenever we see something, we just try to know about it. We try to Google it, or else whenever we exhibit some symptoms, because as humans, we all have the symptoms like whatever we discussed before. We have anxiety, we have stress, and we have angry. So these are all basic emotions. Everyone will have this. So on basis of that, we shouldn't diagnose, we shouldn't come into a conclusion that it is a disorder. And some people will suggest that, some people will tell that by seeing us, by observing us, they tell that you are having this disorder, you are having that disorder. So it is not very accurate. It helps. See, when we try to search in Google or when we try to ask someone, to some extent it helps, because when we know things, we try to get better ourselves. We try to work on that symptoms. So to some extent, it will be positive effective on us. So going on, so when we diagnose and when we say that we are having that disorder, and it is not like we cannot say that we are having a disorder. Self-diagnosing your mental illness may lead to making it seem less important sometimes, and sometimes we may magnify that. We may magnify and see that seeing 2 or 3 symptoms, we magnify it and we think that we assume that we are having a disorder. Yes, as I said, educating ourselves is better, but do not get into conclusions. Should always seek a professional help to diagnose the mental disorder. It is very obvious that if we want to go to any place, we directly keep that place in a Google and we directly reach that there. So it is different when it comes to mental health. So we cannot diagnose ourselves by seeing the criteria. Sometimes, as we discussed above, the criteria for the diagnostic criteria for the generalized anxiety disorder, though we are seeing all the symptoms in us, we may not be having generalized anxiety disorder, because there are many other interventions and symptoms to be accessed by a psychologist or a certified clinician or therapist or a psychiatrist. So it is better to seek a professional help whenever you feel that you are having symptoms, your symptoms are getting worse. So that's moving on to the next slide. Causes. So causes for this generalized anxiety disorder are biological, physiological, psychological, environmental, social, and mental. Coming to the biological factors, genetics. So genetics research indicates that roughly 1/3 of the risk for GAD is inherited. So while there isn't one single gene, various physical differences are linked to anxiety disorders. So it may be caused by genetics also and neurotransmitters. So neurotransmitters, imbalance of GABA, serotonin, and norepinephrine. So neurotransmitters are a chemical messengers that carry signals between nerve cells from our neurons to other targeted cells like muscles and glands. So they act as a major one in transmitting signals from our brain to the other body parts. So whenever there is an imbalance in the neurotransmitters, there are chances to get generalized anxiety disorders. So GABA acts as a brain's natural calming agent, slowing down nerve activity and reducing the likelihood of neurons firing excessively. GABA is gamma aminobutyric acid, and serotonin is involved in mood regulation, emotion processing, and anxiety, and sleep, and digestion. Norepinephrine is released in response to perceived threats or stressful situations, triggering psychological changes like physiological changes like increased heart rate, blood pressure, and alertness. So we came across the biological factors and neurotransmitters, imbalances of neurotransmitters. So why does this imbalance happens? This imbalance has several reasons that may be through the genetic or brain chemistry or by birth. So there are or sometimes the reactions in our body are like whenever we are affected with some illness, a chronic illness or illness, physical illness, that also may affect our bodily function and may affect on the functioning of these neurotransmitters. Coming to the psychological factors, personality. So personality traits. Personality traits, individuals with certain personality traits, such as those prone to worry and perfectionism or negative affect, may be more susceptible to developing GAD. So people with these personality traits are more prone to develop GAD. And thinking patterns, people with negative thinking and irrational beliefs can also develop GAD. And avoidance and perfectionism. So avoidance situations or activities that trigger anxiety can actually reinforce the anxiety in long run by preventing the individual from learning that the feared outcome is unlikely. And the next one is environmental factors. Environmental factors are like stress, the prolonged stress to stressful situations, and whether at work or school or with personal relationships, can contribute to the onset of worsening of GAD and trauma. So trauma is also reason for GAD. So whenever we experience a childhood abuse or trauma or neglect, these can be reason for GAD, which may develop at childhood or it may develop when we get adult. It may develop later also. So that impact is always there. And next comes parenting. So parenting. So sometimes overprotective parenting and critical styles of parenting. So there may be a lot of reasons behind that where some parents don't know how to raise or how to educate or how to tell their people. So this may affect the children indirectly in developing GAD. And social factors like isolation. So when you are isolated from groups and people, you may develop GAD. And some social factors like divorce or relocation, job loss, so can also affect generalized anxiety disorder. And some physical factors, health issues like chronic illness like heart diseases, or thyroid problems, substance use are also a reason for developing generalized anxiety disorder. So moving on, here are the causes and risk factors as we discussed for generalized anxiety disorder, like chronic illness, job stress, certain personality traits, genetics and brain chemistry, traumatic experiences, alcohol and drugs. So these are all some of the risk factors as we discussed in earlier slides. Moving on to the impact. We discussed the causes. Now the impact of GAD on personal life. So impact may be physically or impact may be on family, impact may be on work and social impairment, impact may be emotional or psychological strain and lowered quality of life. When it is physical health effects, so you may develop, there are chances to develop certain diseases like IBS, irritable bowel syndrome. Anxiety can trigger or worsen the gastrointestinal issues like irritable bowel syndrome. As we discussed earlier, the neurotransmitter, which are connection between our brain and our body parts. So when these neurotransmitters are not working well and there is imbalance and uh, there is no correct connection between these brain and our gut health, there are chances to develop such kind of diseases and syndromes like IBS. And when it comes to family and social relationships, we may lose our relations and we may cause tensions and anxiety, and we may withdraw difficult in maintaining relations and increased conflicts between partners and increased disturbances between parents and children. So GAD may cause family and social relationship issues. And it also impacts on work social impairment. So poor concentration and constant worry reduce performance and productivity. As we discussed, one of the symptoms of GAD is not concentrating, like where we couldn't able to concentrate on things. So that poor concentrates leads to constant worry and reduced performance and productivity. And emotional and psychological strain. So often occurs with depression, causes persistent unease and tension, and lowered quality of life. When we are having all these symptoms, so they can irritate and we can lose the quality of life. So which affects directly and inversely in affecting like enjoyment, relaxation, and day-to-day functioning. Risk of substance use. There are chances in GAD, we may also, like people with GAD may misuse drugs or alcohol to manage symptoms. Functional impairment. Anxiety causes significant distress or problems in daily life. So when it causes significant distress, so it may create some problems in daily life where we cannot concentrate on day-to-day activities. We cannot perform that activities well. Moving on to the next. So when to seek professional help? As we already discussed, to not to self-diagnose and what not to do. And now when to seek professional help, it is very important that like we get excessive worrying and difficulty coping or other health mental conditions and anxiety, if you feel like anxiety is worsening and we are getting physical symptoms. So all these symptoms interrupt in our day-to-day activities and they disturb and we cannot concentrate on day-to-day activities. Then we need to seek a professional help. Yes, Fatima.
Yeah, Mani, thank you. Explained very well. Mental status examination. Mental status examination, which will access with the various aspects of the client mental state to help us to understand the nature and the severity of the disorder. So when the mental status examination for the GAD, it will assess the patient's cognitive and behavioral functioning, which includes the appearance, mood, thought process, and insight. So why we have to do this mental status examination? To establish the baseline of the client's mental state and identify the specific symptoms and pattern which are associated with the GAD. And the most important, to differentiate the GAD from other anxiety disorders or other mental health conditions. For example, the appearance and behavior. So when this includes the observation about the clients, grooming, the posture, how they are giving the eye contact, the overall, for example, the patient with the GAD might exhibit restlessness and irritability or forgetting. And the second one is the speech. So the MSE, which assess the rate, the rhythm, and the tone of the speech. So the patients, how the with the GAD, how they might have the rapid or pursued speech or appeared hesitant and all. And next one is the mood and affect. Mood always refers to the sustained emotional tone, and while affect is the immediate expression of the emotion. When a client with the GAD might report feeling anxious or worried, and their effect might be constructed. The next one is the thought process and content. The thought process, this one, it will examine the organization and coherence of thoughts. So the client with the GAD might exhibit excessive worry or rumination, but generally their thought process remain logical and goal directed. And next one is the cognition. This involves the assessing orientation, attention, memory, and other cognitive functions. So the clients with the GAD typically do not have any significant cognitive impairments, but they might have difficulty concentrating due to their anxiety. The next one is the insight and judgment. Insight always refers to the client's awareness of their mental health condition, and the judgment relates to their ability to make sound decisions. The clients with the GAD generally they have the good insight and judgment, but might have some difficulty making decisions when they are experiencing a high level of anxiety. So let us to coming to the treatment. Treatment, which is a supportive care and therapy after the appropriate assessment. Treatment for GAD, it should be include the different kind of the therapies like psychotherapy, CBT, and the medication. And generalized anxiety disorder. Could you please go previous slide? Thank you. So GAD, when typically which is treated with a combination of the psychotherapy and medication, and sometimes with one or the other, depending on the individual needs. When we are coming to the psychotherapy, it is an umbrella term that describes the treating the psychological disorders and mental distress through the verbal and psychological techniques. So like psychological techniques, which includes the psychoeducation, worksheets, and art therapy, mindful relaxation techniques and all. The cognitive behavior therapy, it is one of the most effective approach for treating the GAD. Next one. And medications for the GAD. Medications may also be a part of the GAD treatment plan according to the intensity of the individual GAD, and which is having in the medication like SSRIs, like selective serotonin reuptake inhibitors, serotonin non non-dependent reuptake inhibitors, and benzodiazepine and buspirone. All these things, medication, it will be should be prescribed by the uh, certified clinician or the psychiatrist or the clinical psychologist. The research, it indicates that the combining the psychotherapy and medication can lead to the most significant improvement in the GAD symptoms. Let us to come to the myths and facts. We all know the anxiety or the GAD, generalized anxiety disorder, which is just worrying. But actually, GAD is a real and a terrible mental health condition. And GAD will go away on its own. This is the myth. But in a reality, it is it has to be treated and within a particular plan by the help of the psychologist and certified the clinician and psychiatrist, and the combination of the treatment and all, it is manageable. People will with a GAD are weak or lazy. People, but in a reality, they are not weak or lazy. They are having due to the excessive the worrying and all, they cannot perform the works, or they used to be worry about to perform the things, and they sometimes they used to be postpone the things. And panic attacks always leads to the heart attack. But actually, the panic attacks means which is reducing in the BP and all. They will get fainted for some time, and they will be normal after the certain first aid and treatment. Medication is the only way to treat the GAD. But according to now only we said that not only the medication, along with the medication, the psychotherapy, which will help the client with the GAD to manage for the rest of their life. Anxiety disorders are very rare. This is also one of the myths. But anxiety disorders, it is everyone in the now the daily challenges in the nowadays we can feel, we can experience any person in any irrespective of the age and gender. One thing we can say that the early interventions and treatment can improve the outcome and the quality of life for the individual with GAD. Up to now, we went through the what is GAD and how to diagnose it, when we need to seek the psychologist, the professional help, and what are the treatment methods and all. How many of you know that what exactly the psychologist will do? Okay. Okay, let us to go give you the demo and how the uh, psychologist will deal with the client with the GAD. Penny, can you help me with the...
Yes, ma'am.
Hi, Mani, how are you?
Yeah, hi, ma'am. I'm a little tensed.
Little tense. Can you elaborate your condition?
Yes, ma'am. These days, I'm feeling very worried about my career and future.
Can you
So,
stop the screen so that we can see you people?
okay, ma'am. Yes, ma'am. These days, I feel little worried about my career and future. So, how is it going to be? I'm very worried about that, ma'am.
Okay. Since how long you're going through?
It's been more than 8 months, ma'am. 8 months to 1 year. I'm feeling the same. I'm feeling like thinking constantly about my career and future.
How can you cope up with this?
No, ma'am. I tried many ways. So, whenever I get symptoms like restlessness, sleeplessness, and irritability, so whenever I get these symptoms, I tried lot of symptomatic treatments and I tried to do mindfulness activities and lot other, but I couldn't able to control my worry. So they are not helping me.
I can see the worry on your face. So, what is the impact on your life, like a career, family relationship?
Yes, ma'am. It is impacting a lot in my relations at my working place, wherever I go. So I little worried every time. So it is disturbing me a lot in day-to-day life activities, ma'am.
Okay, Mani. On biological intensity scale of 0 to 100, where you want to keep your worry on the scale, like a 0 is a no worry, and 50 is the manageable, and 70 is not manageable, and above the 80s, which is severe worry.
Okay, ma'am. I understand you are saying 0 is very less worried and 100 is very much worried. So in that case, I would say that mine is more than 80, ma'am. I feel that because it is irritating me a lot.
Mani, are you on any medication or are you going through any medical illness?
No, ma'am. Right now, I'm not on any medication, but I generally take some vitamin deficiency medications. Other than that, nothing else.
Mani, how motivated are you to come out of this
So
on the 0 to 100?
this worry is impacting me very much. I'm shouting at others, yelling at others. So I am very much motivated to get out of this situation, get out of this worry 100%, man. I'm trying it a lot.
Good, Mani. Let me explain the therapeutic alliance, which is the collaborative and trusting relationship between a therapist and a client. It is crucial component for successful therapy. You should be regular for the sessions. You have to follow the activities which therapist suggests you.
Okay,
On
ma'am.
today session, let us to go with one intervention, that is worry box and worry period. Worry box technique is a simple and effective and which you use it to help GAD individuals
Okay,
to
ma'am.
reduce the overthinking, to help the delay and limit worry to designated time and gain control over the anxious thoughts. Okay, Mani, let's start with the creating a worry box. Are you ready?
Yes,
Do you
ma'am.
have an empty box or any jar with you?
Yes, I have, ma'am.
Could you please write on the box like a worry box in a bold letters and show me?
Okay. Yes, ma'am, I wrote.
Which looks good. Now, whenever a worry arises, write it on a piece of paper. And while writing, be specific about the thought which causing the worry. Drop
So,
the written.
should I write it on paper, ma'am?
Yes, please.
Okay.
Take a piece of paper.
Yes.
Write exactly what is your worry right now and the thought behind the worry. Be specific and write it on the piece of paper.
Okay. Right now, my worry is about my career and managing relationships. I'm little worried about managing time also, ma'am. Yes, I wrote.
So now fold the piece of paper, whatever you written the worry, and drop this worry into the box.
Yes, ma'am.
And tell yourself that I will deal with this, the worry in the worry time. So set aside the daily 10 to 20 minutes to open the box during that particular time. It might be in the evening or it might be before the sleeping hours. It's up to you. And whenever you open the box, read and reflect on the worries. Like, is it still bothering me? Can I do something about it? If not, can I let it to go? And analyze either the worry can be solvable or uncontrollable worries. If it is solvable, then make a plan for it. And if it is uncontrollable, practice to let them to go.
Okay, ma'am.
So make sure about the worry box and worry period whenever the period comes, whenever that time only particularly you have to open and go through the worry.
Yes, ma'am, definitely. I feel like interesting and I never got this idea. So I definitely try this. And I usually get relax or leisure time at evenings. I definitely keep all my worries in worry box and I try to open it in evening time. I keep a specific time and open it.
Okay, Mani, thank you. Can you think any coping statement which
Coping
can
state.
motivate a coping statement which is very short and very specific, which can motivate you in the specific worry time? Like you said that you're facing the worry.
Yes,
So
ma'am.
like worry can drain all your energies.
Yes. Yes, the coping statement I can give myself is uh, why wasting time when you have separate time for worrying, as you prescribed an intervention. So connecting that, so why to worry always? This is my
Very
coping
nice.
statement.
Very nice. Okay, could you please write on the paper?
Yes.
Dear audience, now Mani has got one coping statement for the worry. Can you also give some coping statements?
Will I share it?
You can share in the chat box, ma'am.
I cannot share in the chat box. Okay, it's okay.
Yes, very nice. Ma'am Sojanya has wrote that we can't control all the events. Anvita has wrote, I can handle this situation. Swatina ma'am has wrote that I can handle this later. I'm safe right now. Nilofer went through the worry will take you nowhere. Thank you all. Really such a nice coping statements, which really motivating us. Thank you. So here also we have given some other statement. The worrying is a waste of time. It doesn't change anything. It messes with your mind and steal your happiness. Yes, Mani, could you please go with the tips?
Yes, ma'am. Nice statements by audience. Before concluding, I just want to tell some tips to reduce our anxiety, and it may work for reducing generalized anxiety disorder, and these tips may work for normal people also to reduce their symptoms and move on smoothly with their day-to-day activities. So these are like learning about disorder will always gets us to deal with symptoms easily because we know perfectly about the disorder, and eating healthy foods and identifying triggers and keep physically active and make sleep a priority and socializing, sticking to our treatment plan, using stress management and relaxation techniques, limiting or avoiding caffeinated beverages, quitting smoking, avoiding alcohol and recreational drugs, writing a journal. So these are all tips which may help in reducing the generalized anxiety disorder and normal anxiety. And this also helps in various disorders where we can easily cope up with these tips. This is the end of session. Thank you. Thank you for attending.
Can we have Q&A?
Yes, ma'am. So you can ask, audience can ask questions in the chat box.
So there are a few questions which were shared in the chat history.
Okay.
Can we go through them? One of you can help me.
Yes, ma'am.
If they were already answered by your PowerPoint presentation, we need not answer. If the question was beyond your PPT, then we may answer.
One question was asking by Chandrarekha ma'am, why there is imbalance in the neurotransmitters?
That is already answered by Mani in the PowerPoint presentation. I was following it.
Someone mentioned, can you please explain the causes of nocturnal
Enuresis. Bedwetting. Yes. That is in general layman language, bedwetting. So what is the question here about it?
as a result of general anxiety disorder and other anxiety disorders?
Yes. We actually agree with that. General anxiety or normal anxiety or general tensions could be one reason for bedwetting, but it is not always the same. It is not always only anxiety lead to bedwetting issues. In some cases, it could be like it could be genetic also. Sometimes what happens, bedwetting will continue till 14 years. You take all measures, there is no stress, no tension for the child, but still it will stop only after 13 years. So we need to understand what is the root cause of it. If at all it is general anxiety, then it is very, very easy to help the child to calm down through mindfulness and relaxation techniques and help the child to stop. And there are so many behavior therapy techniques which can help bedwetting. Yeah, one of you can read, Mani or Swati can read questions or...
Yes, ma'am.
Yeah, please.
There is one question. Perimenopause and which is a causes a GAD for no apparent reason. How to deal with it? Most girls with a GAD in Manakam get GAD in perimenopause as per research. How to deal with it?
The beautiful therapy for this issue is mindfulness and relaxation, practicing these techniques continuously. So I have an experience of this sort of cases where we have a module called MRA with well-being toolkit of 30 techniques. And that was actually practiced by some of my clients, that 30 techniques, and really gave a good results. So one thing is finding out the root cause. And when you already know the root cause, the second could be practicing mindfulness and relaxation techniques. If you're not able to manage, you can always go for medication. And never think that medication have side effects and medication hesitation. There are so many, apprehensions about medication. But when the intensity of the problem is high, better you use the medication. Okay?
Okay, ma'am. Another question is,
yeah. Yes, ma'am.
is there a way to reduce negative thinking?
Definitely there is a way, and our Sahaya students are well equipped or practiced to help you, control or manage your overthinking. But you cannot completely stop thinking or stop overthinking, but you can always manage your overthinking. And the major therapy used is CBT, cognitive behavior therapy. Okay. Any other questions? Are good to go for the day?
Yes, ma'am.
Yes, ma'am.
Okay. So this is about Sudisha Counseling Center. So as
Okay.
we,
So I'll take leave. You can conclude.
okay, ma'am.
Thank you so much, all the audience who joined, participants, and looking forward for the next webinar coming soon tomorrow evening. I'll be there.
Thank you, ma'am.
Yeah, this is about Sudisha Counseling Center, which is a unit of Manojagrithi, where certain courses are offered in diploma, in diploma and positive parenting, and internship for the MA psychology students, and separate phase direct counseling sessions to the clients. So various facilities are provided by the Sudisha Counseling Center. And also Sudisha Counseling Center organizes various meetings and trusts provided by the NGOs, and fund various programs, provide various programs funded by various organizations. And Sudisha Counseling is always there for mental health services. And if you want to reach, please contact the below address to reach out the Sudisha Counseling Center for any help regarding the mental health or tying up for any programs about mental health awareness. Thank you.
Thank you.
And
Thank you all, audience.
Yes, this is our next webinar conducting tomorrow about postpartum depression and premenstrual dysmorphic disorder, which is presented by Navya Sharma and Dr. Preeti Reddy. So hope you all join and listen to all these webinars. Thank you.
Thanks, everyone.
Thank you, one and all.